if you ask somebody with gambling disorder to describe their experience whenever they are full tilt engaged in gambling, a large portion of the time they're going to say something akin to, "It's like I'm on autopilot." They don't notice really anything else going on. And what's actually happening there is they're correct. You're caught living only subconsciously in those moments. And so back in the days that Rick was describing of, going to the track and then having maybe 12 or 16 hours between the ability to place a bet or sports betting, you have to know a bookie and you don't have a cell phone to text him or an email and you've got to get a hold of him maybe through a few different people. You had all of these moments at that time where you had the ability to come back conscious, right? And stop the bleeding for a second and maybe have some thoughts that are going to be more conducive to you making a change. Now, with the access being 24/7, these kids never get an opportunity to become conscious. And that's why I think treatment is so important now more than ever, especially if you have a child who is, or a young adult who is completely defiant against getting treatment, completely in denial. They have not had an opportunity to have any conscious thought on the matter yet because through this device, whether they're gambling or not, they are completely stuck in subconscious dopamine chasing. And so if we can get them into our care for 5 weeks of no distractions from the cell phone, no distractions from work, no distractions from school, and get basically a dopamine fast, that's probably the first time they're going to be able to have any type of meaningful conscious thought about their problem in a very long time.